during the peak of the COVID epidemic, when we didn't know how to treat this disease.
Sure.
When people were, instead of in an intensive care unit, you may have a patient die once or twice a week. Maybe you were having 10, 12 patients a day
that's a lot.
die. And just for a physician or a nurse or anyone involved in patient care, it's agonizing to watch and to feel like you can't do anything, and you don't know what to do. And then you don't have the equipment or the personal protective equipment or
right.
And so there was a kind of a feeling, and that's this idea of moral injury, and leading to burnout in the health professions. Now, some more subtle ways that can happen is by, and I want to get to this in the AI context, is in the context of a clinician working for a big health system.
Okay.
Where the health system is putting, or the insurance company is putting the bottom line before what you think is right for the patient.
So you're saying in the model with its output,
and
one of the priorities would say for the economic benefit.
Right. But even before AI, that you have prior authorization. So the insurance company doesn't agree to pay for what you really think that patient needs.
Sure.
And what are you going to do? That's a little bit of moral injury every day as you get sort of beaten down by the system that prevents you from really doing what you think is right. So is it a system that is primarily focused on efficiency, which means at the margin, you don't prescribe treatments that are only marginally effective?
Yeah.
Well, you, the doctor, this patient may say, I want that treatment because you're respecting that patient's values.
But the output says, we're not going to do that because it's only a marginal change
over this many statistics, and it doesn't. So that's why we say the clinician, and here I'm including nurses too, the doctors and nurses need respect and beneficence and justice every single bit as much as the patients. And that's a new concept. It always was that we were the ones with the power.
Sure.
And we owed it in a fiduciary way to the patient to have these responsibilities. But now there's a third person in the room.
Yeah.
A third person is the AI. And they aren't morally neutral as AIs. So that needs to be more visible to the clinicians.